Did you know that there are four main parts of Medicare? Thea here, founder of Medicare Insurance Solutions, here to discuss the four major parts of Medicare and the basics of Medicare to help you make a very well-educated decision with your Medicare plans. But first of all, let me give you a quick introduction about myself. I have been a Medicare advocate for about 20 years now. I have my life and health license in multiple states, and I am appointed by most Medicare certified insurance carriers, whether it's a Medicare Supplement, Medicare Advantage, or Part D plans, to help you with your Medicare needs. So let's begin. Like I said, there are four parts of Medicare: A, B, C, and D. A and B are your original Medicare. These are your federal benefits because you've worked in the United States for at least 10 years. C and D are those Medicare plans that you enroll through private insurance carriers. So your original Medicare generally begins the month you turn age 65, or the first of the month you turn age 65. If your birthday is on the first of the month, it begins the month before, okay? You can refuse Medicare at age 65 if you continue to be actively employed by a large employer, which is defined by Medicare as having 20 or more employees. But once you retire, you may want to switch to Medicare right away to avoid any penalties. So going back to your original Medicare Parts A and Part B. A, like in Apple, only covers four benefits: inpatient hospital, skilled nursing facility, home health care, and hospice care. These are all that there is for Part A, okay? You guys, most of you have paid into the system, so you've paid for Part A. So once you become entitled to your hospital Part A, you generally don't have to pay a premium unless you did not meet enough quarters, which is 40 quarters, or having worked in the United States for at least 10 years. But for most of you, there is no premium for Part A. However, if you're admitted to an inpatient hospital and you only have your hospital Part A, you're really not covered in full. This year in 2025, the standard Medicare Part A deductible is $1,676 per benefit period. And a benefit period is defined by Medicare as being admitted as an inpatient in the hospital on your first day and has not been transferred to another facility for 60 days in a row. So if you're going back and forth in a 12-month period, every 60 days, you could be billed that $1,676. However, if you stay longer than 60 days, then on day 61, you'll have a copay of $419 per day. And on the 91st day, after 3 months, you'll have a copay of $838 copay per day. So there is no cap. There's no out-of-pocket maximum with just Part A. That's your inpatient hospital. Part A is also for skilled nursing facility. Keep in mind, folks, that Medicare does not cover long-term care. Skilled nursing is generally like a rehab center where you go after, say you go for a hip surgery and you need to recover at a skilled nursing facility for physical therapy. That's where you go. Medicare covers you up to 100 days, but how it works is you're really only covered with zero copay for the first 20 days. And if you stay longer than 20 days, then on day 21 to 100, you will have a copay of $209.50 each day. Part A is also for home health care and hospice care. Home health care, again, nothing custodial, no long-term care. Home health care is if you're coming out of the hospital, you need help at home with perhaps your physical therapy, occupational therapy. Medicare will cover that in full. You don't have to pay anything, okay? And then hospice, of course, is end-of-life care. So that's it for Part A. There are the deductibles and copays. Copay, by the way, folks, is a flat dollar amount that you'll be responsible for. To wrap it up, Part A, again, is your inpatient hospital, skilled nursing facility, home health care, and hospice care. That's your Part A. Moving on to Part B. Part B, like in baby, is anything medical. Your doctor's visits, your surgery, your emergency, therapy, blood, any test, MRI, CAT scan, dialysis, chemotherapy, ambulance, physical therapy, outpatient services, outpatient surgery, anything medical, okay? Once you activate that, there is a premium for Part B. Most of you will have to pay for Part B unless you have perhaps a state assistance from your state. The Part B premium in 2025 has increased. Last year, the minimum Part B premium was $174.70 per month. This year, it's $185 per month, and it can go as high as $628.90 per month if you are a higher wage earner. And the Part B premium is based on your past 2 years modified adjusted gross income. So for example, we are now in 2025, the government will base your Part B premium on your 2023 AGI, okay? Again, if you belong to a higher income bracket, you will be charged what's called IRMA, Income Related Monthly Adjusted Amount. Just because you belong to a higher income bracket, again, your Part B premium can be higher than $185 per month. And I'm going to show you a chart here just so you can see kind of a cheat sheet of where you fall in that bracket. The good news is if you have a life event, you can absolutely appeal to lower the Part B premium. It can be retirement or work stoppage, it can be divorce, it can be loss of income producing property. Feel free to give us a call and we'll help you appeal that as well. So they don't have to base it on 2023, for example, when you were making more versus now that you're retiring. So there is a solution for that, okay? Regardless, we all have to pay that Part B premium, okay? However, you must be informed that if you only have just Medicare Part B, you're really not covered in full. With just Part B, you will be responsible for a standard Part B medical deductible of $257 in the year 2025. Last year it was $240. So again, that's increased as well. So this year the medical deductible is $257, that's just once per calendar year. But the fact remains that Medicare only covers you 80%. So you're always responsible for a co-insurance of 20%. Whether you go for a simple doctor's visit, a major surgery, chemotherapy, dialysis, anything medical, right? So now we've established the fact that your original Medicare, your federal benefits from Medicare Parts A and Part B really does not cover you in full. I'm now going to move on to, of course, there are solutions, right? If you're no longer actively employed without a credible employer health plan, you got to find ways to cover what Medicare does not pay, okay? And there are generally two ways to cover that. One is not better than the other. It's just really up to you and your needs. And that's what we do here at MedICare. Like I said, I've been doing this for quite a while. My job is to guide you to the right direction based on your needs and budget, of course, okay? So there are two options. One option is a Medicare Supplement, which is also known as a Medigap plan, and then you pair that with a drug plan. So the first option is, of course, you keep your original Medicare Parts A and Part B, you enroll yourself with a Medicare Supplement or Medigap. Supplement, Medigap, it's one and the same. It simply means it supplements or it covers the gap of what Medicare A and B does not pay, okay? And with that, you have to pick up a separate Part D like in drug plan for your medications, okay? So Medigap plans are designed to cover just medical and hospital, okay? The beauty about a Medigap plan is there are absolutely no rules. Why? Because with a Medigap plan, Medicare, which is really the largest insurer nationwide, accepted by over 95% of providers in all 50 states, will pay as primary, and your Medigap or your medical supplement will simply pay as secondary. So what that means for you is no rules. You don't need network providers, you don't need referrals, you don't need prior authorization, you don't need claim forms. Medicare will simply pay first, and any supplement you enroll with is required to pay after Medicare pays, okay? It is very important, folks, for you to understand that in most states, and again, we cover multiple states, but in most states, you get one golden ticket to enroll with a supplemental plan without having to go through medical underwriting. Some states that does not require medical underwriting in the future, for example, are Connecticut, New York, and Massachusetts. But in most states, you may want to grab this opportunity, okay? Supplement plans have a premium, and in most states, it's based on your age and your gender, right? And supplement plans, to make it just a little bit more confusing, are also coded by letter. So for example, the top of the line plans for you folks in 2025 are called plans G like in George and N like in Nancy. Now these are called plans. Plans G like in George or N like in Nancy are designed to cover Medicare Parts A and Part B. So don't confuse that, okay? Now, these plans are called standardized plans. What that means for you folks is these insurance carriers, because again, it's offered through private insurance carriers, are allowed to differ just in premium, but not in benefits. So to give you an idea, top of the line plan for you is G like in George. Plan G like in George will cover generally most of Medicare Parts A and Part B, except you're responsible for just a one-time medical Part B deductible of $257 once per calendar year. Once you've paid that deductible, everything is covered. Your hospital deductible and the rest of the 20% that Medicare does not pay, even skilled nursing facility. It will even give you some foreign travel emergency benefits. So that's how Plan G works. And again, ABC company can offer it to you, for example, maybe for $100. DEF company can offer it to you for $110 a month. I'm just throwing out numbers there. My goal is to find you a good plan that would best fit your needs and your budget. Like I said, I've been doing this for a while. I do have a beautiful software that looks up the ratings and the stability of each carrier, because my goal is also to have that long-term relationship with you so that when your premiums go up, I continue to be able to find you less premium plans. So that's how a supplement plan operates. The other supplement plan is called N like in Nancy. N like in Nancy is a lower variant plan compared to Plan G, but generally it potentially could be maybe $20, $30 less than the Plan G on a monthly basis. The only difference is, like I said, with the Plan G, all you pay is a one-time $257 deductible, then you're covered in full. With the Plan N, you're paying a lower premium, but you also will pay that $257 deductible, and then on top of that you pay a copay only $20 for any office visits, $50 to the ER, and it also won't cover what's called Part B excess charges. Part B excess charges will only be billed if you happen to go to a provider who does not accept Medicare assignment. That provider is legally allowed to bill you an additional maybe 15%. And I know this is confusing, that's why it's best to give us a call. So those are just two examples of supplement plans. There are others that we can discuss once you give us a call. But understand that with a supplement plan, that first option, you pay your Part B premium, you pay your supplement premium, whether it's a Plan G or a Plan N, and then now we have to figure out a drug plan called the Part D like in David. Figuring out a drug plan to cover your medications really generally depends on what you currently take. And that's where we also come in. Because understand, again, it's offered through private insurance carriers as well. But each insurance carrier, they do have different ratings, different drug lists, different formularies, different drug tiers, different copays. So my job is to really help you, of course, save money, knowing the restrictions of each carrier. Okay? But again, on that first option, essentially you're paying your Medicare premium, your supplement premium, your drug plan premium. So that's one option. Okay? Remember, with this first option, one golden ticket for life. Okay? I'm now going to move on to the Part C, like in Charlie, of Medicare. This is another option, which is called a Medicare Advantage plan. Medicare Advantage plans are designed to cover your medical, your hospital, your prescription, all rolled into one plan. These plans are generally offered, of course, through private insurance carriers as well, but these are managed care plans. The common plans are HMOs, Health Maintenance Organization, or PPOs, Preferred Provider Organization. So these plans are all in one plan, okay? These plans become primary to Medicare. So if you go this route, you no longer use your Medicare card. It's still active because with both options, you have to keep Medicare A and B. But with this Medicare Advantage plan, you leave your red, white, and blue Medicare ID at home, and you only bring your HMO or PPO ID card to go to your doctor, specialist, hospital's pharmacy. Okay? It's probably similar to what you have now through your employer or your Affordable Care Act or any individual plan. Okay? These are HMOs or PPOs, managed care plans. Now, one good thing about this plan is they're available at lower premium. Some may even have zero premium, right? But you kind of pay as you go. You pay for minimum copays for every visit that you make. It may be, I'm just throwing out numbers, $20 to a primary care, $40 to a specialist, $300 each day to a hospital. But the beauty about these Advantage plans is even if you're paying co-pays, you're protected by an out-of-pocket maximum. What that means is, just as an example, your bills, if you hit something catastrophic and you get bills for over $100,000 without a Medicare Advantage plan, with the Medicare Advantage plan, each plan is required to have an out-of-pocket maximum, maybe $6,000, $7,000, $8,000. It depends on the plan that you pick. So you do have protection, okay? However, because these are managed care plans, it is very important to make sure that your doctors are called in-network, contracted with a carrier, okay? HMOs will generally only allow you to go to their in-network providers. PPOs will give you in and out of network, but you have to pay higher copays if you go to out-of-network providers, okay? And if you give us an opportunity to be your agent, we will discuss all of these options with you and eventually kind of land you to the right plan that would best fit your needs, okay? So again, two options. First one is a supplement with a drug plan. Second one is a Medicare Advantage plan that covers medical, hospital, and prescription. All of these are our expertise. We're here to help you. If you have any questions, Medicare can be confusing, but we make it easy for you. My name again is Thea Luzuriaga. I'm the founder of Medicare. Keep in mind, folks, that our clients have been with us for many, many years. We are never allowed to charge you a single penny for now and for life. If you have any questions, no matter what state you're in, we've been doing this for many years over the phone or on Zoom, please feel free to give us a call. Thea Luzuriaga, founder of Medicare, at 864-625-2112. Website is MedicareTLC.com, like Tender Loving Care. The name of my company is Medicare, because I care, Insurance Solutions. If you like this video, please hit like and subscribe below. Thank you so much, and let's make Medicare easy for you. Have a great day, folks.